Okay, good evening, everyone. On behalf of the Technician Committee and the Education and Professional Development Committee, I would like to welcome you all to today's webinar entitled Pharmacy Technician Practice Advancement Initiative. I'm your moderator for this evening's webinar, Raphael Roman, Pharmacy Technician Representative to the Board of Directors for the New York State Council of Health System Pharmacists. And we are thrilled to have Christa Clay and Leslie Serrano as our presenters for this evening's program. Let's first start off by getting to know our speakers a little bit better. Leslie Serrano is a dedicated certified pharmacy technician at Montefiore Medical Center, where she has built a remarkable career over the past 20 years. Currently serving as the pharmacy automation manager, Leslie has demonstrated exceptional leadership and expertise in her field. In addition to her role at Montefiore, she's the co-chair of the Pharmacy Technician Committee for both the New York State Council of Health System Pharmacists and the Westchester County Society of Health System Pharmacists, advocating for the advancement and recognition of pharmacy technicians. Leslie's commitment to her career and her ongoing contributions to the pharmacy technician community has made her a respected leader and a valuable asset to her team. Next is Christa Clay, who is an advanced pharmacy technician and certified volunteer administrator. She has worked as an assessment content and developer and volunteer manager at the Pharmacy Technician Certification Board, or PTCB, where she is thrilled to be able to travel all over the United States, creating exam questions in collaboration with practicing pharmacy technicians, pharmacists, and pharmacy educators. At home in New York, she is a co-chair of the Pharmacy Technician Committee of the New York State Council of Health System Pharmacists, as well as the co-chair of the Preceptor Development Committee of the New York City chapter. Christa is a passionate theater goer and a cello student who makes up enthusiasm what she lacks in talent. She has plenty of talent, ladies and gentlemen, everybody in between, but that's just me talking. So before we get started, I'd like to share a few quick points for our audience. For those who have technical issues during the presentation, please use the chat option to communicate with the office. Every effort will be made to assist in resolutions. For those who have questions that you would like to direct to the speaker, please use the question box or chat option. And lastly, the CE code for this program will be provided at the end of this program. So without further ado, I'd like to turn the floor over to Leslie and Christa.
Thank you so much, Raphael, for those introductions. And thank you, everybody, for being here with us this evening as the Pharmacy Technician Committee presents Pharmacy Technician Practice Advancement Initiatives. Following this presentation, we're going to give you some brief information about this organization, the New York State Council of Health System Pharmacists, because we have a lot of non-members with us here this evening. And you might find that you like what we're doing here, and you might find that you want to join us in the future. So with that, we will commence the CE portion of our presentation. First of all, in terms of disclosures, neither Leslie nor myself have any relevant relationships, financial or otherwise, to disclose that might constitute a conflict of interest. And just a note for everybody who is here this evening, there will be an additional brief discussion, as I said, on the benefits of membership in the New York State Council of Health System Pharmacists at the end of this continuing education presentation. The CE codes, which I know you're all here for both pharmacy technicians and pharmacists, will be distributed at the conclusion of that discussion. It'll just take a few minutes, so nobody will be waiting too long for those coveted CE codes. That said, let's get started with our CE presentation. The pharmacy technician learning objectives this evening are to summarize the general form and function of ASHP's Practice Advancement Initiative 2030 with regard to pharmacy technician role, education, and training, identify opportunities for pharmacy technicians to practice in advanced professional roles and to advance and enhance pharmacy technician education and training, and lastly, to develop strategies to advocate for pharmacy technician education and practice advancement legislatively and organizationally. Very similarly, the pharmacist learning objectives are basically exactly the same, except for that middle one, which is instead to identify opportunities to support and supervise pharmacy technicians practicing in advanced roles. So with that, what is the ASHP Practice Advancement Initiative 2030 anyway? And just so you know, for simplicity's sake, from now on, I'm just going to refer to it as the PAI instead of the ASHP Practice Advancement Initiative 2030, just the PAI for short. So I'll begin with an introduction to this organization for those of you who might not be familiar. The American Society of Health System Pharmacists is a membership organization. It's the largest association of pharmacy professionals in the United States, represents about 60,000 pharmacists, pharmacy students, and pharmacy technicians in all patient care settings. Fun fact, ASHP puts on an annual meeting every December called the mid-year. And that mid-year meeting is actually historically and continually the largest gathering of pharmacy professionals in the world, which is exciting. This year, it's going to be in December in Las Vegas. If anybody is looking forward to attending. So in addition to functioning as a professional membership organization, ASHP is the accrediting body for pharmacy residency programs and also for pharmacy technician training programs. So when it comes to pharmacy technician education, ASHP kind of sets the standard for those education and training programs, evaluates them, and then makes accreditation, grants accreditation status to certain pharmacy technician education programs across the United States. So that's ASHP. For a long time, pharmacy technicians could join ASHP and participate just like any other member. Just recently, at the end of 2023, ASHP launched the Pharmacy Technicians Society, or TPTS. The Pharmacy Technicians Society is kind of like the technician-specific branch of ASHP. So when you join ASHP as a pharmacy technician member, you automatically become a TPTS member as well. TPTS serves as sort of the collective voice of pharmacy technicians across all patient care settings, supporting career advancement, the professionalization of the pharmacy technician workforce, similarly to the way that ASHP advocates for pharmacists and overall pharmacy practice. TPTS is supporting technicians specifically through education, networking, policy development, and advocacy. So ASHP is the organization that initially introduced the Practice Advancement Initiative, or PAI, originally in 2010. So they did this in order to drive pharmacy practice change at a local level. So ASHP has regional or state affiliates all over the country, of which the New York State Council of Health System Pharmacists is one. We are a state affiliate of ASHP. So building on this foundation that was created by ASHP in 2010, the PAI 2030 includes 59 recommendations on providing optimal, safe, and effective medication use. It includes aspirational guidance serving as a roadmap to pharmacy practice advancement. And it includes future-focused set of concepts looking beyond today's barriers to change. And as I mentioned before, the New York State Council of Health System Pharmacists is a state affiliate and state affiliates like us play a major role in PAI 2030. Many states utilize or use the PAI as sort of a starting point for discussions about practice change and practice advancement within the state. So later in the presentation, we are going to learn about many of the ways that organizations like this council in New York and pharmacy facilities, pharmacy employers in New York are already taking this PAI to heart and already working towards some of these goals. So overall, the themes of PAI 2030 are to optimize care via pharmacist-provided comprehensive medication management, to integrate pharmacy enterprise for convenient and cost-effective care, to harness data to improve patient health, to adopt personalized targeted therapies, to increase public health opportunities in social determinants, chronic illness, and addiction. And last but not least, here in bold print, the PAI does include specific, explicit recommendations to advance pharmacy technician roles, which as a pharmacy technician myself, you love to see it. There are 5 primary domains included within PAI 2030, that patient-centered care, of course, again in bold print, pharmacy technician role, education, and training. Similarly, pharmacist role, education, and training. You've got your technology and data science. And lastly, leadership in medication use and safety. So as I said, the PAI was originally developed and launched in 2010. So in the 15-ish years since then, there have been some significant success stories toward achieving some of these goals set forth in 2010. Specifically, with regard to continuity of care, we've observed a 33% reduction in 30-day hospital readmissions when pharmacists provide comprehensive medication management for patients. In terms of residency training, this is huge. We've observed a 270% increase in residency positions available for pharmacy graduates from 2007 to 2019. And a 270% increase, I don't have to point out, is significant. And again, in bold print here, because it relates directly to pharmacy technicians, we have observed a 41% increase in pharmacist completion of comprehensive medication reviews, specifically with a pharmacy technician in a clinical support role. So you're going to hear me say this 100 times throughout this presentation, and it's kind of a mantra here within the New York State Council of Health System Pharmacists, and that is that pharmacists can only practice at the top of their licenses and their scope of practice when pharmacy technicians are empowered to also practice at the top of our licenses and scope of practice. So these roles go hand in hand. We support each other. You can see from these medication review results, that 41% increase, that with collaboration with a pharmacy technician working in that clinical support role, that allows a pharmacist to improve that patient care through comprehensive medication reviews. And the PAI in general does include explicit recommendations for pharmacy technician practice and advancement, which we are going to look at together here today. Each of the 59 PAI recommendations is divided up into 3 sections describing practice-focused recommendations, meaning the overall pharmacy practice or pharmacy technician practice. Organization focused, meaning recommendations that can be applied to pharmacy employers, facilities, pharmacy settings, and profession focused, meaning recommendations that apply to the profession overall, or the professionalization of the role when it comes to pharmacy technicians. So let's look at the PAI 2030 recommendations involving pharmacy technicians. If you're looking at this document as a whole, like all 59 of the recommendations, it's divided into sections, and the pharmacy technician recommendations are labeled D1 through D6. I'm going to pause for some water. All right. So, like I said, all of the recommendations are divided into practice-focused, organization-focused, profession-focused. So in terms of the pharmacy technician recommendations that are practice-focused, the first recommendation is that pharmacy technicians should participate in advanced roles in all practice settings to promote efficiency and improve access to patient care. The second is that pharmacy technicians should have complete responsibility for those advanced technical and supporting roles. For example, order fulfillment, tech, regulatory compliance, supply chain management, diversion prevention, revenue cycle management, and patient assistance programs. Keep in mind that those examples, that it's not an exhaustive list of every advanced role that exists for pharmacy technicians. Those are just some common examples, some of which we see already happening in the state of New York, many of which we see happening across the country. But again, just examples, not an exhaustive, complete list of all of the opportunities that exist. In terms of those organization-focused recommendations, it is recommended under the PAI that all newly hired technicians should have completed an ASHP ACPE accredited technician education and training program. It's recommended that health systems should require technicians to be certified by the Pharmacy Technician Certification Board. I'm just going to add in a side note here. I do work for the Pharmacy Technician Certification Board. I am just reading the recommendations to you. We will talk later in the presentation about the other certification organization for pharmacy technicians, which is accepted in all 50 states. It just so happens that ASHP's recommendation is that the PPCP certification be required. And lastly, from an organization perspective, the pharmacy departments should foster the development of professional career paths for pharmacy technicians. And last but not least, in our profession-focused recommendation, it's recommended that a scope of practice, including core competencies, should be developed and defined for pharmacy technicians in both acute care and ambulatory care settings. The pharmacists and pharmacy technicians among us here tonight, I'm sure that we are all aware that there is no single national standard for pharmacy technician education, training, certification, and there is no one or even two major clearly defined scopes of practice for pharmacy technicians. You never know exactly what is meant when somebody describes the role of a pharmacy technician. So this profession-focused recommendation encourages us as a profession to develop a formal scope of practice, including those core competencies. So now that we have looked at the recommendations themselves, and remember that these are just recommendations put forth by the American Society of Health System Pharmacists. They are not laws, they're not rules, they're not requirements. But they are, in ASHP's opinion, the best sort of path forward, or the recommended path forward to achieve some of our overall practice advancement goals. Most of us on this call today are probably living and working in the state of New York, living and or working in the state of New York. I know I didn't extend this invitation to like the whole country or anything like that. So this discussion of supports for pharmacy technician practice advancement that already exists is going to focus mostly on stuff that is going on here in the great state of New York. So PAI section D1 that we just looked at states that pharmacy technicians should participate in advanced roles in all practice settings to promote efficiency and improve access to patient care. So off the top of my head, I'm just thinking about like what kind of advanced roles do I know of, have I heard of, that are actually already happening? Like, what are pharmacy technicians doing at an advanced level already here in the state of New York? And off the top of my head, I could come up with three presentations that were given by council members in a council context just this term, the 2024 to 25 term, that highlighted pharmacy technicians practicing in advanced roles. All of these presentations, it just so happened, are actually more like case studies presenting like this is an advanced role that we created for pharmacy technicians in an institution. And these were the results. These were the successes that we experienced when we supported pharmacy technicians practicing in advanced roles and elevated qualified technicians into those advanced roles. So the council puts on what's called the annual assembly every spring. And among the first annual assembly presentations just this year in April was entitled ASHP-PAI, The Missing Piece, How Pharmacy Technicians Bridge the Gap in Medication History and Focus on Medication Reconciliation. Earlier in the year, there was a joint presentation, the first entitled Medication History Program at URMC, Empowering Technicians, and the second entitled Developing a Hospital-Based Pharmacy Technician Training Program, Recruitment Strategy. So these are just examples of, like I said, case studies, facilities that are already supporting pharmacy technicians in advanced roles in accordance with PAI 2030. And you can see here on this list, those three presentations included speakers, both pharmacists and technicians from 5 different hospitals from all over New York, including Montefiore, Nyack, NYU Langone Health, and also a Long Island location of NYU Langone Health, University of Rochester Medical Center, and New York Presbyterian in Queens. And again, this is not an exhaustive list of everywhere that there is an advanced role available for pharmacy technicians. These are just 3 examples that I could come up with without even like researching it off the top of my head that have been presented by this council just this term. So these roles are out there. Some of you listening here tonight might be practicing in an advanced role at a different facility that's not listed here. Some of you might be supervising technicians practicing in advanced roles already. But I just wanted to highlight that these things are not new. There are examples and precedents in place and studies that demonstrate the successes of pharmacy technicians practicing in these advanced roles. And again, like I said, when pharmacy technicians are practicing at the top of our abilities, that allows pharmacists to practice at the top of theirs. And ultimately, of course, excellent patient care is the primary goal and our first focus. So moving on to PAI section D2, that one states that pharmacy technicians should have a complete responsibility for those advanced technical and supporting activities. This is the one that listed the not exhaustive examples. And those examples, again, were order fulfillment, tech, regulatory compliance, supply chain management, diversion prevention, revenue cycle management, and patient assistance programs. So I just wanted to bring to your attention that for several years now, PTCB has actually offered certificates for pharmacy technicians in several of these advanced roles that are specifically called out within the PAI. That's not why we did it. We weren't like checking off from the PAI recommendation specifically. We created these certificates because there was demand for them from practicing pharmacy technicians. So just highlighting the ones that are specifically called out or held up as examples within the PAI. We offer a certificate in technician product verification, or TPV. That's also sometimes referred to as Tech. Tech basically is technician verification of filled prescriptions in some contexts instead of pharmacist verification. And again, in some contexts, not in all contexts. New York State does not currently have legislation or laws that explicitly allow TPV or Tech within the state of New York, but there are several states that do, where technicians are participating in these verification roles in some way. PTCB offers a certificate in regulatory compliance, in supply chain and inventory management, and in controlled substance diversion prevention. And again, I only bring these up or highlight these specifically because they are listed as examples within the PAI, but that's not every example of every advanced role for pharmacy technicians. So in support of practicing certified pharmacy technicians across the United States, PTCB also happens to offer a certification in sterile compounding. We just launched a brand new credential for pharmacy technician educators, meaning in formal education institutions like colleges, universities, vocational training centers, and also including like technician trainers within pharmacy settings and facilities. We offer a certificate in immunization administration, billing and reimbursement, hazardous drug management, medication history, medication therapy management, non-sterile compounding, point of care testing. And then when you earn combinations of those certificates, we also have the CPhT Advanced designation, or Advanced Certified Pharmacy Technician, which is just kind of a step up from the entry-level CPhT certification. None of these certificates is required by any state or board of pharmacy or even employer that I am aware of. But these are opportunities that a pharmacy technician could take on to sort of demonstrate your expertise in certain topic areas. So I bring this up just to highlight that these opportunities are out there. This isn't new. Pharmacy technicians have support across the United States, and especially in New York, practicing in advanced roles. PAI recommendation D3 states that all newly hired technicians should have completed an ASHP ACPE accredited technician training and education program. Again, just a reminder that these are not laws or rules. They are simply recommendations. But that is ASHP's recommendation, is that everybody is getting some level of standardized training and education as a pharmacy technician. That can come from a formal education institution. It can also come from on-the-job training, formal on-the-job training through an employer. So this screenshot here is actually the official ASHP Pharmacy Technician Training Program directory. It lists every accredited training program in the United States. I just sorted by the 6-ish that are available here in the state of New York. I say 6-ish because if you look all the way over to the right of your screen here, you'll see that some of these institutions are designated as candidates for accreditation, and some are designated as fully accredited. Accredited means fully accredited, that these programs have been evaluated by ASHP and ACPE, and they have been granted accredited status either at the entry level or the advanced level. It just so happens that all of our programs that are available in New York are accredited at the entry level. That means that they require 400 hours of externship. The other option for some longer and more in-depth, let's say, training programs is accreditation at the advanced level, which requires 600 hours of externship before somebody can graduate from the program, and includes some additional standards that have to be met by those advanced programs. You can see here we have 3 fully accredited education programs here in the state of New York. We've also got 3 that are listed as candidates for accreditation. When a program applies for initial accreditation from ASHP, ACPE, they are often granted candidate status, which means that the full accreditation has not been granted yet. It's still under review. It usually means that the program is relatively new. And they get to sort of function as an accredited training program while their candidacy is fully considered by ASHP. So I find it particularly exciting. You can see here that we have these programs in development, not just in education institutions here in New York, but at actual health systems. I mean, Binghamton University is obviously a university. That program is available through the School of Pharmacy. But right here in New York City, Mount Sinai Health System and New York Presbyterian Hospital have developed and launched technician training programs within those actual facilities. So sometimes facilities will do that for people that they've already hired and are then going to train. Sometimes it is a program in which somebody can enroll, and often those graduates sort of feed into the associated health system or pharmacy facility, like for hiring purposes once somebody completes the course. So some of these, there are no specific requirements as to how long these courses have to be, as long as the standards are met, and specifically those externship hour requirements are in place for ASHP accreditation. But this directory is always expanding and changing as new programs are developed. Like I said, it's especially exciting to me to see pharmacy facilities, health systems, medical centers investing in their pharmacy technician workforce by offering these kinds of comprehensive training programs and then going to the effort to get them accredited to ensure that the highest standards established by ASHP are being met, that the PAI recommendation, that we are striving for that goal. And, again, always excellent patient care is at the end of the line. It's everybody's primary goal. Moving on to repeat PAI recommendation D4, that one stated, again, just a recommendation, that health systems should require technicians to be certified by the Pharmacy Technician Certification Board. As I said before, PTCB is not the only organization in the United States that grants that CPhT credential. The other one is the National Health Careers Association, or NHA. And both organizations have very similar eligibility requirements for somebody to be able to earn this credential. For initial certification, both organizations offer an education pathway, meaning that to apply through that pathway or to be eligible through that pathway, you have to have some kind of education and training as a pharmacy technician. Both organizations also offer an experience pathway through which somebody who maybe does not have formal education or training as a pharmacy technician, but has learned on the job, can still be eligible to earn that credential. And again, just to be totally upfront, the letters themselves, CPhT, that you put after your name in a professional context, we do not distinguish between like which organization granted that credential. Both organizations, NHA and PTCB, are recognized as CPhT credential grantors in all 50 states. Now, some employers have preferences. And of course, the PAI recommendation does express a preference, but you're just going to use the letter CPhT after your name once you become certified. It's not going to identify which organization you earned that through. And similar to the initial certification, in order to renew those certifications, the requirements are very similar. Pharmacy technicians renew our CPhT credentials every 2 years. Both organizations require 20 hours of continuing education credit. I'm sure this is all old news to the pharmacy technicians above us. 1 hour of those 20 has to be on the subject of patient safety. 1 hour has to be on the topic of pharmacy law. Did you know? Here in the state of New York, CPhT certification is required for pharmacy technician registration. That is only for registration. Probably most of us here on this call tonight are registered pharmacy technicians. If you are practicing in a compounding setting in the state of New York, that is required. It's not required in every state, and it's not required for every technician here in the state of New York. If you are already working in a compounding facility, probably you have already registered with our Board of Pharmacy here in New York. And just as a general sort of career advancement tip, even if you are not currently working in a compounding setting, a lot of those facilities want to hire technicians who are already registered. They don't want to hire you at a hospital, let's say, if you are currently working in retail, and then wait for you to register. So it can be a little bit of a resume booster, even if you're not currently working in a compounding setting or a facility that requires you to be registered. If you already had that registration in place, it does open up some of those job opportunities that might not otherwise be available, or that might put you at the front of the line when it comes to hiring, might set you apart from other candidates who are not registered. General tip. PAI recommendation D5 states that pharmacy departments should foster the development of professional career paths for pharmacy technicians. Career paths are also sometimes called career ladders or career lattices. This describes a progression from an entry-level position up into higher levels of pay, skill, authority, etc. There are numerous studies from all over the country that show repeatedly the establishment by a facility or an employer of specific pharmacy technician career ladders or lattices increases job satisfaction and employee retention. Because when you can see a clear path from where you start to where you might want to go, and opportunities, especially in terms of earnings that might be available to you, it makes it much easier to decide whether to stay or to move on to perhaps a different employer. Finally, PAI recommendation D6 states that a scope of practice, including core competencies, should be developed and defined for pharmacy technicians in acute care and ambulatory care settings, which I'm sure we would all agree are kind of the two main pillars of not only pharmacy practice, but pharmacy technician practice, not the only practice settings, but the big two. So there is no single national standard for pharmacy technician education, training, or certification in the United States. So each board of pharmacy, each state kind of gets to decide for itself what kind, if any, of education, training, or certification registration is going to be required of its pharmacy technician workforce. Here in New York, we do not have a formal defined scope of practice that tells us exactly what a pharmacy technician does in either of these two sort of pillar settings, but related to the establishment of a formal pharmacy technician scope of practice. I did want to point out, in case you are not aware, because this just happened a few days ago, last week, that here in New York, Senate Bill S3236A just passed the New York State Legislature. This is a new law that allows pharmacy technicians to practice in any pharmacy setting, of course, as we are accustomed, under the supervision of a licensed pharmacist. I lost my train of thought. This law is intended to sort of correct a misunderstanding, let's say. Sometimes when a law is too specific or too explicit, people end up getting left out of that law, which was a situation that we ran into here in the state of New York. But this bill sort of takes care of that issue and defines, well, doesn't specifically define what constitutes a pharmacy. They just call it a pharmacy. So if you are a pharmacy technician working in a pharmacy, you are now allowed to practice under the direct supervision of a pharmacist. That law is expected to be signed by the governor before the legislative term ends. And once it is signed, it will take effect immediately. Those of you who might remember when registration became a requirement here in the state of New York, you might remember that that did not take effect immediately. We had like 2 years to work towards those registration requirements. This law will take effect as soon as it is signed by our governor. So I wanted to open up the floor to questions at this time. I believe Raphael is going to jump back in here. And just a quick reminder, we do have CE codes for you. We're going to take some questions, and then we're going to have a quick discussion about benefits of membership in the council. And then we will deliver your CE codes.
Excellent. And thank you so much, Christa, for your wonderful presentation. Again, ladies and gentlemen, and everybody in between, if you can please place your questions inside the chat, I'll be definitely relaying them back to Christa. You know what? I actually have a few questions for you, Christa. So based on your presentation, you had mentioned the differentiation between PTCB and NHA. We know that PTCB is the kind of overarching go-to popular, and I know, granted, you do work for PTCB, so this might be a conflict of interest, but can you go into a little bit more granular reason or your theory as to why PTCB versus NHA is the more popular of the bunch?
So this is entirely just my personal opinion. It is not based on like research or data or anything like that. But I think of it as the Pharmacy Technician Certification Board. I like to say that we created this credential, or that this credential is created by pharmacy technicians for pharmacy technicians. The only profession that we credential at PTCB is pharmacy technicians, no one else. Whereas NHA credentials all kinds of allied health professionals, which is fantastic. And again, like I've never worked for NHA. I don't know anything about the inner workings of their exam. They are accredited by the same like test development organizations as we are at PTCB. So I'm sure that their standards are excellent, as excellent as ours are at PTCB. I actually was well into my career as a pharmacy technician, maybe like a decade into my career as a pharmacy technician before I even learned that there was another credentialing organization for pharmacy technicians. It just so happened when I got certified more years ago than I am going to announce here. It was just PTCB was the only organization that I had ever heard of that offered this credential. PTCB was launched in 1995. This is our 30th birthday this year in 2025. So that is my theory, by pharmacy technicians for pharmacy technicians, and I am very proud of that.
Excellent. Thank you so much for giving us that input, Christa. We have one more question. We have two questions that came in. Are there any plans to partner with the colleges to provide some kind of degree program for pharmacy technicians specifically? I mean, for both new and existing pharmacy technicians.
So it just so happens this is in no way like my news to announce, so I'm not going to. But I will say that I was at a pharmacy technician symposium presented by the New York City chapter of the council recently. And it was at least floated, if not formally announced, at this event by the host, that they are investigating. This is a university that is investigating exactly that, intending to create exactly that, an associate's degree program here in the state of New York for pharmacy technicians. You might be aware that in California, and to my knowledge, California is the only state that requires this in a way. It's not the only way to become a pharmacy technician in the state of California, but it's a way, and that is to earn an associate's degree as a pharmacy technician. So those programs are definitely out there. And of course, the distinguishing feature of an actual associate's degree as a pharmacy technician is that those are college and university credits that are transferable to a further degree, like a bachelor's, to other schools, whereas most like vocational or certificate training programs for technicians are not. You can't take those credits anywhere else. So,
Gotcha.
like I said, it's not my news to announce, but your voice is heard. That request is heard. And yeah, I know of at least one university that is working on it.
Excellent. Thank you so much for that response. So we have an additional question in the chat, but I want to give some space right now for Leslie to give her portion of her presentation. Katerina will get back to you in a moment. All right, Leslie.
I'll advance your slides, Leslie. Hold on 1 second.
Okay,
Is this Leslie?
so
Oh,
there you go.
So, hi everyone, thank you for joining us. So I'm here to talk about the council, which I am a member of. I do work from Montefiore Medical Center, so I'll be speaking on behalf of the council. And I'm sorry, Raphael, do you still hear me? It looks like Christa.
Nope, I can still hear you.
do you want me to advance the slide?
Okay. Christa, you were frozen. Sorry.
Oh.
So the council is the premier provider of education and information for New York State pharmacy professionals. In this council, we have tried our best to have the pharmacy technicians upgraded or to be seen, as Raphael has said many times before. So the council, the New York State Council Health System of Pharmacists has 9 chapters across all areas, which I belong to the Westchester chapter, where I am the co-chair of the technician committee, along with being a co-chair with Christa for the state council as a whole. So I encourage everyone to join the council in any area, wherever you're located. There's an area basically almost everywhere within the New York State itself.
Leslie, do we still have you on the line?
Yes. Oh,
Okay.
did you? I'm not sure
Yep,
what's happening. I'm having technical difficulties today.
It's okay. Happens to the best of us. Chris is currently projecting her slide on the benefits of the New York State Council of Health System Pharmacists memberships.
Okay, so as part of this benefits, it's CE events that are basically presented throughout the month. It's publications, We have professional involvement. So sometimes different chapters have different affairs, helping with your resumes, and networking, which is my favorite. For me, I joined the organization for networking. Besides the great dinners that we have on a monthly basis, we also get to engage with other pharmacy professionals. Next slide. So our members are pharmacy technicians and pharmacy students. We have pharmacy directors from all of the health systems, depending on which chapter you go on. And we have also acute care pharmacists, hospital pharmacists, ambulatory pharmacists. Next slide. So the cost, which is a sore subject, is $50 a year for pharmacy technician. There is a technical pledge that you can join for $25 a year. This is nowhere in comparison to all the great dinners that you will have and the CEs that basically you will acquire if you join our program. Next slide. I think there's one more.
Yep, that's it.
No, that's it. Okay.
I tried, but there's nothing else.
Oh, thank you so much. So without further ado, I want to thank you, Leslie, and thank you, Christa, for providing today's webinar.